Hey everybody, this is Dr. Michael Hyland, and I'm the owner of Hyland Physical Therapy and Wellness in Broken Arrow, Oklahoma. For those of you who don't know me, if you're just now catching this series, that's okay. You can go back a few weeks and watch from beginning to today, especially if you want to binge watch. We have a YouTube channel, Hyland Physical Therapy. You just search for Hyland Physical Therapy and Wellness on YouTube, and please feel free, and I'm asking you today, if you're watching this, go ahead and go search for that and subscribe, and I'll put a link to that in the notes or in the comments below after the video, so you could get a link directly. So we're continuing a series on treating or self-treating low back pain, and today we're going to be talking about getting to the core. Up until this point, we've talked a little bit about how to explore what movements what feels better, what relieves your pain, and different positions of rest that you can get in, and even combining some exercises in those rest positions. Today we're going to start to talk about the core exercises that are crucial for stabilizing and protecting the low back after injury. With any instance of low back pain, whether it's a severe injury or even just an ache, the muscles that stabilize the spine itself start to atrophy and weaken, and they need to be strengthened. So it doesn't really matter what kind of back injury you've had. It's super important. I'm going to show you two exercises today that are really simple and can profoundly affect the stability of your back, and it's very important to address this when you're treating low back pain. And another call to action, I'll get to that at the end of the video, but we'll go ahead and go to the exercises now. First call to action was the YouTube channel. So I'm going to show you two exercises. You're going to do these on your back, and I would start all the basic stuff on your back or sitting, because you want to make sure that you're starting to stabilize the core and the low back before you go into advanced core exercises. So you're just going to lie on your back, have your feet bent, or your knees bent rather, and the first exercise, some people call them dead bugs, and I'm kind of dorky enough to just call it what it is. It's alternating marches in supine or lying down. If you, first of all, if you contract your core, you want to be able to hold that deep core contraction while you're doing these exercises. When you do limb movements while you're holding a solid core, it strengthens your core because you're preventing extra movements in the pelvic area and so forth. So just gently try to bring your navel or your belly button towards your backbone, so you're just kind of gently sucking in that lower abdominal area. You should really feel that go all the way around to your low back if you're doing that right, because it does truly solidify everything all the way back to your spine. Those deep those deep spinal stabilizers are going to contract as a reflex, and you killed two birds with one stone. So while you're in this position, you can choose to do a march just with the lower body. So you're just kind of holding that core contraction, doing a little march, trying to, if you put your hands here, you can feel your pelvis, and you shouldn't feel a lot of movement. If you do, try to pull that contraction in a little harder. Try to suck it in a little bit harder, okay? And you want to keep breathing while you do this. If you hold your breath and try to suck it in, you're going to create more intra-abdominal pressure. It's a big word, but that actually could cause more problems with intra-abdominal pressure is not good for blood pressure and your heart and lungs and things like that. So you want to try to keep breathing while you're doing all this. It's kind of like rubbing your head and patting your stomach at the same time, but or vice versa. Anyway, just gentle marches like this, and just alternating. And then you can combine that. If you want to start out, you could just do the legs, and if you want to get a little bit more advanced, you would do opposite arm and leg like so. So just consider yourself marching, but you're lying on your back. And the second one I feel like is prescribed a lot, so it may seem cliche, but it's really important. Pelvic tilts is something else. Last week we did cat-cow, 2 weeks ago, we did cat-cow pose, which is a yoga position, a yoga movement, but it actually is a pelvic tilt movement. So you're getting spinal movement, but you're also getting pelvic tilts, posterior and anterior pelvic tilts. So we're going to do that lying down with a core contraction. So pull that in, and then you're going to roll your lap towards your face, or flatten your low back. That's another way to think about it. And then roll the opposite way. You're making a hollow in your low back. So roll this way and roll that way. Starting out, when you're doing the marches, the pelvic tilts, either one, don't go overboard. Just try to do 10 repetitions at first. 2 to 3 times per day, doing 10 each time. I wouldn't do 3 or 4 sets of 10 right there. I would just, you got to work this. We've got to be realistic. You're going to try to be working this into your day. So do a few 10 or 15 reps, or work your way up to 15 and 20. But honestly, by the time that your back starts feeling better doing these, you could advance to more challenging exercises. So you don't want to keep doing we don't want you to keep doing the same exercises for weeks on end and never stop doing them. We want you to keep continuing to advance and do even more challenging things. So 2 call to actions for you. Number 1, subscribe to my YouTube channel, and you're going to get videos like this and notifications of those videos every week when I do these, because I do upload these videos to YouTube. And make sure that the little bell, you make sure that little bell is not crossed out, because that you won't get notifications if that little bell has an X through it or a cross through it. So anyway, so subscribe to YouTube and make sure that your notifications are turned on. And 2, second call to action is, if you're suffering from low back pain, whether it's chronic or it just happened, a physical therapist is the practitioner of choice for you. I offer free consultations at this practice, so my call to action is to call me with the number below, or sign up for a free discovery visit, and we can figure out how to help you to meet your goals and the transformation that you need. I hope you have a great day. I really appreciate you watching. I'll catch you next week for Wellness Wednesday. This is Dr. Michael Hyland, physical therapist, and as always, be empowered.